Okay, we'll call the meeting to order at 4:05. Certify open meeting laws? Yes. Requirements met? Okay. We have a 9-item agenda. Is there a motion to approve?
So moved.
Move to
Motion-
approve.
Motion and second. All those in favor say aye.
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 Opposed? Okay, it's accepted. You have a copy of the minutes from the October 14th meeting in your packet. What's your wishes on that?
Move to approve.
Okay, there's a motion
Second.
and a second. Any comments? None? All those in favor indicate by saying aye. Aye.
Aye.
Any nays? Okay, that's passed. Okay, first item after our essentials, we have Adam here. Adam, do you want to introduce yourself to this illustrious crowd?
Sure thing. Sorry, I don't have a song or anything. So I'm Adam Trunzo. I'm with the University of Wisconsin Extension Office here in Trempealeau County, and I'm a youth and families educator. One of the roles that Extension has within the county is to kind of support some of the policy, systems, environmental level programming, in addition to some of our direct education to parents, to youth, and things like that. So one of the committees that I support under the CJCC, which is the Criminal Justice Coordinating Council. If you're not familiar with that body, it's the DA, the judge, Human Services, Health Department, all of the entities within the county, and outside members from the general public. We meet and we basically discuss the criminal justice system and mechanisms to improve its outcomes, which is reducing costs, improving outcomes, and public safety. So a part of that is this concept of restorative justice that's been adopted pretty widely in a lot of different areas. And the main concept of restorative justice is restoring the harm done to the victim, if there is a direct victim, or the community, if the community is affected by that harm. Something like graffiti or something like breaking and entering. A lot of times it's fines, it's charging a certain amount of money or a certain amount of, incarceration time. What this does is, if that's appropriate, that's appropriate, but what it does is it forces the person who committed that harm to come to terms and understand the harm that they've done to the community or to that person, with potentially at the end of that some sort of reconciliation between the victim or the community and the offender. Any questions about that kind of writ large restorative justice? So what we've been doing over the past several years is previously working with Goodwill Restorative Justice out of Eau Claire, a fellow named Dana Brown, and he has, for free, come down into Trempealeau County regularly. He currently, his organization switched to a group called Tandem out of Eau Claire because Goodwill kind of shifted gears. But they are currently supporting the DA's office in a case here, kind of a long-term case, again, for free. And the hope is that we would be expanding that into trainings, developing volunteers with the support of Jeannie and others in the area that are kind of primed to support work like this, and to provide a whole range of just restorative justice services. But part of that was, if we could be considering for next year's budget, some sort of contracted services agreement potentially down the road. So this is very much just an initial touch base. Hi, how are you doing? Please consider this. If you hear it come up, say, oh, that's something that we're maybe thinking about. And think about potential options for either funding or, as well connected as you are, thinking about potential volunteers or organizations that might benefit from something along these lines. What you have in front of here is, it's not perfect, but it's a general rundown of the services that they're willing to provide, what we've said that we're able to commit to. It could look like training jail staff, sheriff staff, different folks around, to just kind of incorporate some of these principles into their work. So instead of just locking somebody up and hoping that they that they, change their ways or change their thinking. We work with them in a meaningful way to understand the harm that they've done. Because a lot of these folks are like, what are you going to do, take away my birthday? But if we can really show that impact, that's important. The other side of this that impacts human services a little bit more directly is in Eau Claire, what Tandem does is they work with the embedded county social workers that work with school districts to run youth restorative justice programming. And we see that already independently kind of happening in the Osseo Fairchild school districts and others that are clamoring for some of this support. So if there's some mechanism that either Jay knows or that we can consider over time supporting policies that would help us to implement those sort of practices in the schools. And a lot of times it's youth that are supporting and helping that with. So again, a child, a student maybe says something very offensive to another student. It's very easy to just pull that student out and punish them over here. But if you can work with them about why it was offensive and have them hear in some meaningful way the impact that had on that other student, that's a lot more powerful, and it can lead to a lot more learning that isn't just kind of setting this student aside and punishing them in that manner. So no action required, just a general touch base. One thing that I would like, if you have the questions now or thoughts, like any red flags that you see with some of this or anything that you see here, or things that you would like to see a person like this potentially or contracted services really work to address.
Any questions? You've been active for several years, I think, in terms of. Can you turn your mic on? That would be a good idea. Thank you. You have worked in the jail some over the last several years. Can you give us some idea what kinds of things you worked at or in that situation?
Yeah, absolutely. So I've been quite active in various things, anything from determining the bed size, which I was kind of crewed the committee for like what that was going to look like, all the way up to what I do currently, which is reentry support services. And I'm just kind of the tip of the spear for that. And behind me is a lot of different organizations, Peace Lutheran in Pigeon Falls, Rural Unity Through Hope, and a lot of different organizations, Probation and Parole, Department of Corrections, that all support me when I go in there and meet with somebody. I then can connect them to other folks here. Like I'm expecting a phone call about somebody who's being released from jail. They don't have any clothes for the winter. They were picked up in the summer. And they need a coat and shoes and socks. And so we now have those things because of this network of volunteers and community members who see the need, are willing to dedicate the funds and the volunteer time to get it for them. A lot of times it's very easy to have a kid's closet, right? We all want to give kids clothes. That's great, feels good. But adults need that too. But there aren't nearly as many mechanisms to get the people who really need it when they need it.
That is definitely an example of restorative justice, I think, too, isn't it? A part of the.
It's certainly restoring those people and trying to get them back to where they're going. Sure. The restorative part is more towards the harm that they've done. And a lot of that's kind of cognitive behavioral therapies that we could do if we had kind of a programmer in the jail or contracted services there. What I typically do is both reentry planning and providing resources to those folks, as well as doing some employment programming, parenting programming, different things like that with some light, guide on the side, trying to help them talk through some of their concerns or issues. So an example was last week, having 3 moms, one very new mom who's incarcerated and kind of talking through what parenting looks like, especially at a distance, and being able to provide that very young parent who has a lot of emotional stress being away from their child and not really sure what to tell them about their parents being incarcerated, and being able to provide them the services, the materials and the resources and the education about how they can stay connected in that child's life to provide a better outcome for both that child and that parent.
It's kind of interesting as you look around, nursing homes have social workers. Mm-hmm. Hospitals have social workers. But you look around the county jails, and there is not much of that kind of support. And the social workers in many of those are involved in doing just some of the things you're talking about, providing follow-up and making sure people have a place to go when they leave here and so forth. So, Richie, you dealt with the jail for
I think
several
it's
years.
a good idea. Have you talked to Brett, the sheriff? Yeah.
So not specifically about like a restorative justice person, but we meet quite regularly for the opioid settlement committee and other organizations. So he's on board.
You guys aren't, in the past, haven't been equipped to do a lot of that sort of thing. You're providing that
A lot of
daily,
ministry.
a lot of that daily, you provide the daily care, but that follow-up and so forth is a different one. I know Olin Femright drove people to work
Oh, yeah.
and over the years, and he kept looking for someone like that to take his role, I think.
Yeah.
And we've been struggling with that over the years as well as, and working with the jail staff also on some of those policies. So like they were concerned when we were providing rides to people because like where are we taking them? What's what risk are those community members taking on? And working with both the community members to understand and train them sufficiently by people who've been in those situations, but also working with those government agencies and saying, hey, like if we want these people to go back into communities, we need to be comfortable with community members accepting some small amount of risk of engaging with another community member to help them. A lot of times we want to completely separate out these people and say a social worker can help them or somebody else probably is helping them or there's some organization, the whatever is probably helping them, but it's us. It's the community members. It's Olin Femright. It's me providing rides to somebody with my kid in the back seat, and I get them to where they need to go. And maybe we see them again in a couple of years, but like they've gotten a little further down the road. So
It's Scott Brown who does a lot of transporting, and our librarian in Whitehall who does a lot of support for persons coming out of jail. But I think going back to talking about restorative justice, I believe it's something that is really critical in our county. I'm sorry, I'm kind of losing my voice here. And I would love to see some of the programming that and we've talked a lot in our small groups about working with adolescents and even just starting a traffic restorative justice program where kids I had to step away for a second because I was having a coughing fit, so I don't know if you talked about that, but I'm very interested in doing some of that, really kind of basic start out with some of the adolescents in Trempealeau County. And according to Dana Brown, we could use some of the services Eau Claire County. If you want to explain a little bit about that, Adam. I can't talk very much.
yeah. So what she's referring to is a traffic panel. So there's kind of two things here. One is a teen traffic panel. So young drivers, they drive recklessly, they injure somebody. Maybe it's not the person that they injured that they have to meet with, but it's a member of law enforcement, maybe somebody else who's lost a loved one in a reckless driving accident, and they have to sit down and meet and listen to those people's stories and kind of understand the harm that their actions caused. Maybe not that person specifically, but what their actions caused to people. What Jeannie's also referring to is recently they were looking at having an OWI restorative justice panel. So people who've very similarly, but people who've been affected by OWI vehicle crashes or things like that. So again, it's something that's provided. We can provide it. The judge or the DA can order it as part of their sentencing. And then they have to, pay whatever fee, $50, whatever, to attend this traffic panel. But it's another mechanism we have to be able to kind of bring people a little bit further along the idea of accepting the consequences and the effect of their actions on other people. And that has been shown to be one of the truest ways to get somebody, less of a chance to recidivate.
Okay, any other comments? Thank you, Jeannie.
Sure.
Okay, thank you.
Thank you.
Our next item for discussion is the resolution for the merger of the Health Department and Human Services. Jay, do you want to take a lead on that?
Sure. So we met, Rebecca and Susan and I and Tricia, and I believe we also met with Jen before she left as well. We've been working on exactly how this would look, and we were fortunate to have an example from Door County when they combined their Health and Human Services departments a number of years ago. I think it was 4 or 5 years ago. And so we looked at theirs and the resolution that they had put forward. And so we cribbed off of that. We tweaked a few of the timelines and things like that and made it more specific to our county and our situation. But this is all based on the statutes that cover, actually there's a statute that covers moving the health department under human services and merging the departments and how that looks. And it just, that's why I wanted to give you both board compositions for the Board of Health and Human Services Board. I believe we have that handout in your packet. But there are several elements to this, and just to kind of talk you through, we listed the statutes there, which there are a number of them, and in different areas of those statutes as well. We thought it made sense to begin with for the Board of Health to be the lead board introducing this, but then when Dick and I were talking, he thought it made sense for us to have jointly introduced as a resolution to the county board. So when you look, we've got all the state statutes listed there, and then it starts to talk about, once we start to merge those two departments, exactly some of the specifics, like using the word health in the title of the department now. And so a little further down, you'll see that we've proposed that it becomes the Department of Health and Human Services in Trempealeau County. We also looked at, now that we have a county administrator, how does that process work, with appointing the health officer, with appointing board members. And then the last piece of this, obviously, is combining the two boards as well. And we thought, when we were trying to look at the timing of this, we thought it made sense that because we've already started down that path, we've been, heading down the path of combining the departments. And so, because of that, sorry, I lost my train of thought here. Health. Oh, because of that, the timing is kind of where I was going. Because we've already started down that path, we thought it made sense to say December 1st would be the timeline for us to officially become one department, after the full board had a chance to vote on it, and also after they've had a chance to consider the appointment of our interim health officer, pending, the posting of the permanent position. So there's a lot of moving pieces to this, so that we thought December 1st for the combining of the departments. And then when you think about Rebecca and the county administrator position and how those boards could be combined, we thought it made sense to give her some time to develop her recommendations and come back to the full county board with what she thinks that could look like based on the composition of both boards by January 20th, which I believe is the next county board is the county board meeting in January. So to that end, we also were wondering from both boards if you have thoughts. When you look at those, I wanted to be able to lay these two statutory compositions side by side and make sure that we're attending to the requirements for both boards. And that's why we gave you those. And so what it's looking like to me is most likely the end result, that we would probably get to is 5 to 6 county board supervisors and 3 to 4 community members. And that would be, that would meet the requirements for this. Because when you look at the Board of Health, for example, not more than 9 members. And then the Human Services Board says not less than 7, no more than 15. So we have to make it work for both of those, the statute said. So it's kind of working through that, giving Rebecca time to, create her recommendations for the board. So that's kind of where where I thought I'd hand it over to you and see if you have any questions or anything else that you see in this resolution that you would recommend be done differently, or it's, like I say, I think it's pretty comprehensive, and it covers all the statutory pieces, so I don't know if Rebecca would have anything else to add.
I was only going to add, I just think so far through our discussion, it's been going very well. I've been just really pleased with Jay and Tricia's leadership, as well as bringing in Chris as the interim for the health department. I think it's just been really when we've been, meeting with Susan regularly. I see this as a really good strategic move for the county as far as communications and things. I think, I had shared with the board previously a couple times, and I can't remember if we've talked about this here as a committee, but there's really not a whole lot of savings. There are some financial savings, but it wouldn't be anything really significant. It's more related to the communications pieces across and working together across those departments, and the efficiencies there, But again, I just think it's the right time with the leadership that's here, and I feel really good about that. In talking about the committee structure and what that would look like, we started going over, everybody on the Board of Health and in Human Services boards, and kind of looking, there's a couple people that overlap, and just, part of that conversation, I would obviously be taking, your thoughts into considering this. It's not something like, I'm just making this decision. These are discussions that I want to have with you, and making sure that, we're doing the right thing, and making sure that the health department has good representation, and so does the Human Services department, and then we're going to start to meld that together.
Bridget, do you have anything you'd like to add?
Initially, Jay, you said 5 to 6 county supervisors, and did you say 4 to 5 public members?
I was thinking 3 to 4,
that-
probably.
Oh, 3 to 4. I just wanted to
Yeah.
get those numbers right, but thank you.
That's
Okay.
at my glance, when I set them side by side, that's kind of what I see, because we can't exceed 9, because that's kind of the ceiling that's set by the Board of Health statute, so.
Any other comments? I guess if you're looking for suggestions, the 9 figure sounds the best to me. Number one, it's an odd number, and number two, it didn't involve as many people that's kind of maxing it out according to the law, so but that would seem appropriate, and then there would be a greater opportunity for good variety of people serving on that.
I think too, if there's it's still interest.
Rebecca or Jay, of the public members, does that include, because obviously we have to have our medical director, so does that include or not include the medical director?
The medical director would be considered one of the community members, so obviously she would have to be one of those people, so.
Gotcha. So then it really takes you down to 2 to 3 others.
Right, yep.
Yeah, I think we want to go with the maximum for sure, since we're condensing, we want to do that.
Yes.
Yeah, and I think also, and I'll just throw this out there, I don't know if you want to have non-voting advisors, if people really felt strongly, like, I don't want to lose this quite yet, but those are all conversations we can have. I know a couple of people had talked to Jay in the past about, thinking about their terms were getting close, and that they might be done fairly soon, so we could maybe absorb a little bit that way, but those are, I can reach out and talk with everybody and get kind of the feeling from everyone where they stand on that.
Any other input that folks would have?
You talk about the terms. for
And
the
if I'm
community
reading
members?
this right,
Almost up?
we're looking at, sorry,
Go ahead, Ron.
I already asked her.
Oh,
I was just asking if the community members were the ones that terms were almost up,
yeah, yeah,
because ours are all up the following year.
right. Go ahead, Bridget.
it looks like you're wanting to passing this resolution at the next county board meeting to go into effect for December 1st. Is that correct?
Right, yeah. Ideally, we would have had the Board of Health meeting first and then this meeting, but just the timing, the way it worked out is kind of the way it is, so that if there could be a joint, it introduced jointly by both boards for the full county board next Tuesday, that would be ideal.
Bridget, as Jay indicated, he and I had talked, and I had recommended that the resolution to be signed by committee members from both committees, and I didn't mean to overstep boundaries here, because evidently initially it was the Board of Health. If you have some objection to that, certainly let us know.
I do not, no,
Okay,
that's
okay.
fine.
Anything else then?
So then I was looking for approval of the resolution to move forward,
Okay,
if we could vote on that.
Chair would entertain.
I'd make a motion to approve this resolution to be brought forward to the November county board meeting.
I'll second that.
Okay, we have a motion second. Any further discussion?
I have one item, Dick. I know there had been talk amongst some community members on these boards and/or county supervisors as to, is the way to go to make this abrupt change? Or is it better to move and until we get this further set up to continue with the two? But I think when I was speaking with Rebecca, and maybe she can comment, I don't think that that's feasible to do, and I just wanted everybody to be on the same page. So could Rebecca or Jace, you speak to that?
I need a little further explanation of what you're talking about, Bridget. I don't understand what you just said. Maybe it's because my head
So-
is like so clogged up.
No, that's okay. So instead of passing the resolution and making a complete board change right in December, that we continue with the two boards for, I don't know what time frame it might be, 2 or 3 months, and make that a gradual transition, or, and I didn't know the exact answer to that, because I know that conversations have been going back and forth a little bit. So if someone could speak to that?
Jay, when did you say the decision has to be made?
Well, it was basically that you would come back with recommendations to the full county board on January 20th. It didn't specify that at that point that it would be,
Sure.
that the boards would be combined.
So I think we could do the December and January meetings as is. And in the meantime, that'll give me some time because, to handle just contacting and talking through everything with everyone. And that's kind of what I have appreciated about the way we've been kind of handling this, is just methodical and taking our time and asking the right questions and making sure we have the right people on board. And so I think that whole process has been, I appreciate, and I think I'm good with that. I think that makes sense. That gives us some more time again to talk as I can talk with everyone or and you're amongst yourselves and just kind of to figure out what's the best way forward on those.
And I think the
And-
practical side of things is we need to make sure that the health department functions are being attended to in the meantime.
Yep.
And that's why we said sooner rather than later for that timing. But we thought the combining the boards, that we want to be intentional and planful about. So we thought, let's not jump on all of this at once. Let's take our time and do it right, so. But we knew that the staff and the health department would need the support, sooner rather than later. So that's why we said, we've already started down the path, but we thought, well, formally, we can do it December 1st, so.
Yeah, and I guess it's that staff component of the health department that I'm most concerned about. And I do feel very strongly that this is going to be a good move forward for them especially. And then my only other final question is, since our last Board of Health meeting, has there been any communication with the medical director of the health department, Dr. Breidenbach?
I haven't talked to her.
No, not from our perspective, there hasn't. What were you thinking, Bridget? Or just as far as the next steps here, or?
Well, I know we have a meeting to follow this, so
Right.
I'm sure she will get all of that information as well. I want to make sure that first and foremost in all of this, that she be a very high priority in conversations and being part of this. I don't think the county at this point in changing all of this, I would certainly hate to see us losing our health medical director. And she's been a very good proponent and person to have as our director. So I am really concerned about that. But we can handle that in the next meeting, so.
Yeah, I would agree. And I'm very interested, in her feedback and making sure that she remains an integral part of it, so.
Okay. And I think due to the timing of this resolution, it is asking Rebecca to examine and evaluate the transfers of powers and duties and so forth, and that no later than January 20th. So if she waits until the 20th, it can't be on the board floor for consideration until the February meeting, and because there'll have to be a board rules change, obviously, in terms of setting up this new committee. So actually, it can't officially, the board itself can't officially occur until after that meeting, so.
Sure.
That gives some time for some of this discussion too. That'll have to go on with, as Bridget's talking about, with the medical director, and who is obviously a key person in this whole process.
Yeah, it's kind of been a learning experience too, as we go through this.
Well, we don't do this every day.
No.
Okay.
Goodness, glad we don't.
Right.
Oh, a challenge is good for you, Bridget. Okay, any other comments from anyone or questions? Okay, on the floor, we have a motion to approve the resolution as printed here and referred on to the County Board of Supervisors. All those in favor indicate it by saying aye. Aye.
I,
Those opposed, the same sign. Motion carries. We have everybody has a copy of this. I assume that it would be appropriate for the board, this board, to sign this at this time so that it can be passed on to the Board of Health when they meet here shortly. Okay? Do you want to start, you'll start yours around then, or
Sure,
your
yep.
copy? Okay.
I would give somebody permission to sign my name.
Okay. I'll witness it. Well, someone else can sign it.
I think sometimes they just put an X if they're appearing via Zoom.
Okay.
I'm sorry I'm not there in person, but you wouldn't want me there.
No, not if you're unhealthy today. Who's taking care of the animals?
Well, right now, both the dogs are being very mischievous.
Of course.
But they've been cooped up all day. They're kind of freaking out.
Okay, moving on, I think the next item on the agenda, I believe, is Jay, your report.
Yeah, I don't have much. Just wanted to share the current vacancies that we have and one item within that. So we had a youth diversion caseworker position that was vacant and open, and we had worked on the job description and everything to get it posted. However,
put the X
one of the things that happened that is now, we're now no longer going to be able to have that position because we've missed the grant deadline. We had misunderstood when the deadline was for this position, for the grant funding, to renew the grant. And so we've missed that deadline. So, so that position is not going to be filled at this point, unfortunately. We've had some conversations internally about how do we prevent this from happening in the future. And we're getting better about tracking things, but we've made some changes already to be able to track better, because the department is so complex as far as our funding streams and all of the grants and state funding that we get. It's just very challenging, and so we're going to have a more central location for tracking, spreadsheet for tracking all of these different deadlines for
I missed what position I was.
Oh, the youth diversion caseworker.
Oh, youth diversion, okay.
Right. Yeah, it's very unfortunate because we said, we got these, mixed up with another grant, which we do have, we submitted that quite a while ago. And the state said, no, once you miss the deadline, you miss the deadline, so.
When's the next opportunity for that, then a year from now?
No, unfortunately, this is a 5-year grant. And so that makes it even more painful.
Ooh, ouch.
So, yeah, it's unfortunate. It's very unfortunate, so. But I wanted to share that and make sure that, we are, the pieces of this, that would have been a good supplemental position to what we're already doing, kind of in our continuum of services with youth justice. It would have provided another good liaison person for the schools as well. And some work with the kids before they get to the justice system. So now we're trying to figure out, so how does that look? How do we keep trying to intervene earlier and not have some negative outcomes from this too, so.
So if you would have gotten that grant, what happens at the end of the 5 years?
So at every 5 years, it's,
New grant, or?
yeah, it's a new grant. If you had it before, you are likely to get it again.
see.
Yeah, and so, but I guess at the end of the day, the grant cycle, at the end of that 5 years, there's not a guarantee that it's going to continue, but that would have, it would have been another good kind of piece in our continuum of services. And so now we're just trying to figure out, how do we make sure that that doesn't leave a gap?
And that was through the state, I
Yeah.
take it.
Yep.
I was just kind of curious, because a lot of grants, you got to absorb them locally after the grant is expired.
Right.
I just wondered.
Yeah, and some grants, this one did not have a county match. Because a lot of the grants have some kind of match funding requirement for county levy dollars, that kind of thing. This did not, so. So yeah, this one hurts. Not gonna
And
lie.
how do you track that now? How do you track when these grants are coming up and?
Yeah,
at-
we've.
currently.
It had been residing within, like our fiscal department tracks a number of those, and a lot of them, actually. And I think this was some miscommunication between units here. It just, the one that we thought, the deadline that we got it mixed up with was, we had submitted that back in August already, so unfortunately this. But now we want to have more of a coordinated approach and, and more central location for some of these things. The state does have a list of timelines. This is where it gets a little problematic, because it's not just one division at the state. You have the Department of Health Services, you have the Division of Children and Families, we have DOJ, DOC, a lot of different funding sources, and there's no one place where you can go for a list of everything. DHS does a good job of listing their grants. DCF, to some extent, but, you know, then you've got the TAD grant through, for recovery court, you know, you've got a lot of things through, like DOJ, DOC. So it's challenging, but that's why we're trying to get a better handle on it and have more central location for all of this. Putting all this information together is, we're gonna get there, but we're not there yet, so. So, the other vacancies we have right now are a fiscal associate position, and that's mostly for accounts payable. And that's a very critical position too. Right now, Kelly, our fiscal manager, is doing accounts payable and her job. And the three of them have kind of divided, well, Sally knows, Sally's one of our fiscal folks too, so, they've divided up the responsibilities. I think we've got a candidate, potentially, but we're going through the process right now, so. The part-time dementia care specialist, I think we are in the works potentially, with someone. We have not hired them yet. And then we've got three positions open in child welfare, 2 initial assessment positions, and 1 ongoing social worker, caseworker. I believe we have at least 1 application for the ongoing position.
And a 4th, the parent aid.
Oh, and then the
4
parent aid
positions
as well.
open?
Yes, that's right. So it's, we have more. I mean, we definitely have more openings and vacancies right now than we've had for a while. So it's a little challenging right now. And the applications are not there, the way they were maybe 3 months ago, 3-4 months ago, unfortunately, so. Any questions about any of those before I move on? Just a couple of more, few other things. We talked last time about the child welfare unit moving into the former sheriff's department offices. That has happened. And then the ADRC has begun to move over to the former child welfare offices. And so I believe at least 3 of our staff have moved over already. And I believe the rest of them are slated to move this week and next week, if I'm not mistaken. So then the rest of the steps of getting all of, purging things from the old building, throwing things out, moving things over, all of those things are in the works and will be done before the end of the year, so.
So the lease will be closed out at that time. We don't have a lease right now anyway, I don't think, do we? Well,
Right, I think it was just a continued
yeah.
from the
yeah.
previous.
So it'll be
lease.
closed out by the end of the year then?
I believe so, yes.
Okay, good.
Yeah. So that will be a good cost savings.
Yeah.
And like I say, the 2 teams involved, both the ADRC staff and the child welfare team, they've been so good about this, and they said, no, we need to do this, we need to get them over here, and we need to save that money so that we can, put that back and not have to spend that next year for the rent, the utilities, all that kind of stuff, so. And then the last item I had on here was just, I thought somebody had asked me last time about the dementia care specialist qualifications. Am I remembering that accurately? Because I did bring those with me this
I
time.
think that was me,
Okay.
because I was concerned that it'd been open for so long.
Right, yeah. Yeah, and because it's part-time, I think that's created another big challenge, with that as well. So, because that's a pretty, I don't want to say niche position, but it's a pretty specialized position, and you need to have some passion for that and be available to do trainings and build your knowledge so that we can build support for, our caregivers in our county, so. But yeah, it's a Bachelor of Arts or Science degree is required, preferably in the health or human services related field, at least 1 year of full-time paid experience working directly with multiple people with dementia and family or informal caregivers, expertise and knowledge regarding older adults, dementia care and support, family and informal caregiver needs and challenging behaviors, skill and experience in facilitating small group learning and discussion, experience with family caregivers of people with dementia and family dynamics, experience in developing collaborative relationships, preferably with community organizations and healthcare professionals, competence in public speaking and engaging community members and professionals, ability to provide culturally competent services and supports, function independently and be resourceful in the roles, adjust work hours to meet with program participants, because a lot of this happens after hours or on weekends, you know, where that's when the people who are caregiving, you know, may have some time to actually engage with some of these programs. Basic computer skills, and then a valid driver's license to travel for community events and make home visits. So those are the qualifications. And like I say, we've got somebody who we've been talking with and are in the process with, so I'm hoping we get there, because this could be a very challenging position to fill otherwise, if this person doesn't work out through this process, so. It's just challenging when you have a part-time position, when it's so specialized like this, you know, it's very difficult, so.
And the job, the requirements or the requirements you're asking for are significantly, very significant.
Yes, I agree.
Okay, that
That is all I
That's
have
all?
for you.
okay. I think we've completed our printed agenda here. The next meeting is scheduled for December 9th. I assume at the same time, same place. So I guess unless anybody has any comments or recommendations for agenda items, we stand adjourned until that date. And thank you.